synaptic dysfunction is a very important features of different neurodegenerative diseases. And what is very interesting is that probably synaptic dysfunction may predate or anticipate the neurodegeneration process. And this is the reason why it is very important to understand at which phase it occurs and which is the correlation with data markers. In general, inflammatory markers, but also neurodegenerative and glial markers are present even in a quite early phase of Alzheimer's disease and in general with the neurodegenerative process. And aim of this study was evaluate the correlation between these different biomarkers in cerebrospinal fluid in different phases of the disease. So we recruited early Alzheimer's disease and the controls, and we checked whether there was or not a correlation between these different markers. And what is interesting is that we found indeed a correlation with a strong correlation with neuronal damage marker, lower correlation with glial markers, but we did not find any correlation with inflammatory markers, which is of interest, of course, because inflammation might be, so our understanding or our interpretation is that inflammatory markers could be after the neurodegeneration process, so they might be a consequence of neurodegeneration and not really the first step or the cause of neurodegeneration. And I think this is very interesting. And if we want to see the effect of the efficacy of an intervention, synaptic markers are of high interest because they might be even more sensitive compared with, again, with inflammation, but also with neuronal markers.